Thank you, Christina. Yeah, I probably have met a number of you, and as a result of our lives being the way they are, I'm involved in a number of things, such as many of you are, all across this province, and I welcome the 5 sites that are joining us. I almost feel a little bit like that Troy Donahue character in The Simpsons, where you may know me from. But for those of you that don't know me, my name is Paul Kerston, and I'm afraid for those of you who do, I'm still Paul Kerston. For whatever that means. I'll let you decide for yourselves. I'm honored to be here, and I'll just tell you a very little bit about myself before I get into what I want to do. And what I want to do is make this very real, because by virtue of my role in this, I'm a non-clinician. So I'm going to hopefully make this, bring it to a level that is more deeply personal, certainly for me. And I consider myself in very good company here, and I say that it's because of you that I am here. And I'm going to bring back that theme a little bit later on when I conclude. I am very fortunate with a number of individuals who are in this audience and a number that are not to be part of the teaching team for the Interprofessional Health and Human Services course on HIV prevention and care at UBC through the College of Health Disciplines. I'm also on the board of the Canadian Treatment Action Council, CTAC, and I'm also full-time employed at Positive Living BC. But beyond that, at a more personal level, on Thursday, April 8th, 1999, shortly after 10 in the morning at the BC-CdC STI clinic on West 12th, the then head nurse informed me that I was HIV positive. And I have been for 14 and a half years since, fully virally suppressed on a first-line regimen and with CD4 cell counts ranging between 600 to 700, sometimes 900, and in the percentage range, the fraction is in the 30s and sometimes low 40s. So I've been doing very, very well, and it's because of you that I'm here. My involvement in this fight, which I believe we're all in together, stems from that personal feeling of this means something to me. And I have a motto. It seems a little corny. It's possibly trite, but I say I'm in this for life. And it really does have a double meaning, but I mean it very strongly. My father gave me good advice when I was young. Many of our fathers did that. Did I listen? No. My dad said to me, there are very few things I'll be able to give you in life, unfortunately. We're not a well-off family. We can manage. We make ends meet. But the one thing that I can be sure of conveying to you that you may not appreciate until you're older is good health. Boy, was he right. I didn't listen, but I will say, and I guess this is now going on record, I have announced my retirement date, which, get a kick out of this, it's 254 days away. I've counted. So 31st of July next year. And in the course of winding down my activities, I'm thinking about how best to pass things along. I've got a memo from my finance director at work the other day that said I could leave April 24th and not work until July 31st. That's how many sick days I haven't used. I still don't get colds or flu, and I don't know why. I'm just very lucky. I was also very lucky that I had an appointment with my primary care physician 3 hours after I received my diagnosis. I was also very lucky that the regimen that we selected worked, and I have done as well as I have for as long as I have. So what I am fortunate to have is something that I think everyone should be fortunate enough to have. And unfortunately, that is not the case. So I was asked to talk about what I learned in the course of working through the original collaborative, of which this is a Continuum of Care collaborative. And what I learned was not everybody is as fortunate as I have been. What I learned was throughout the province, we have a group of very, very dedicated, very highly skilled, very wonderful clinicians of a variety of disciplines. And yet, there are these gaps. There is this cascade or continuum of care, and yet we have these gaps. I was lucky enough to go through the stages from testing to diagnosis to linkage to retention to engagement on antiretrovirals and virally suppressed. I feel very lucky. I don't see why I should be special and different in that respect. We have the skills. So what I learned in the course of this collaborative was that we actually do have these skills. We're all doing this work, but we don't all know how we're all doing this work. And that's what this collaborative means to me. In fact, I take my meaning about this from the word collaborative. And what I've seen in these learning sessions that has been so amazing to me is how there'll be a description from a team from some site, from some area of the province that was involved in the last one. And the team will say, this is something we're having a little trouble with. And the team will say, we're not quite sure how to bridge this gap. We see the gap, we're just not quite sure. And amazingly to me, another team will say, actually, we just worked through that. Let's talk. And they do. That's what this collaborative is. That's what I learned. I learned that the expertise exists. I learned that there really isn't any reason why it can't all come together for everybody throughout this province. I think we have a wonderfully talented group. I have benefited from them. I think everybody should. People share their ideas. People help one another. There have been some things I hope that continue. We call them asks, and I forget what the other side of it is, but one group says we need to learn, and another group says we can help you learn. And it's not that you haven't the skills from the education and you haven't the skills from the experience that you've gained. It's the fact that in every administrative group, there are slightly different procedures. And somebody has done something here that hasn't been tried here, and maybe it actually could be and would work. And that's what I think is so beautiful about this collaborative. When I lived in Ottawa, I worked in Parliament for 7 years there and also at Queen's Park. I was very fortunate in that life too. And I had heard that out in Vancouver and in British Columbia, it was really the best possible care for people living with HIV. I worked in Parliament from 87 to 94. I was infected in 99. I didn't know anything about HIV. I had heard that it was an awful experience to go through, but I did not know what that meant. I actually didn't understand anything except I had heard something about skin lesions or KS, and I had heard something about pneumonia, and that's all I knew. I did tell people I probably would end up living in Vancouver if I could. I just happened to already be living here. I just happened to be fortunate enough to be able to test shortly after a high-risk event I knew I had. I don't see why my fortune shouldn't be the fortune of everyone that is living with HIV and those who are at risk as well. And so I stand before you very fortunate to be here. I am in this for life, and it is because of you that I'm here. Thank you.